A bill legalizing CBD oil for medical use in Idaho has advanced out of a House committee. Capitol correspondent Marissa Morrison was at the hearing this morning and has the deciding factors in the committee's decision.
After 2 hours of public testimony, the House Health and Welfare Committee quickly made the decision to send the bill to the House floor for a vote. Representative Dorothy Moon's bill provides for the lawful use and possession of cannabidiol oil, or CBD, if prescribed by a doctor.
I don't know how many sponsors I have, but I think I've got a boat, dozens and dozens of co-sponsors in the legislature who know that this is the time. And we are a compassionate people.
CBD is a non-hallucinogenic cannabis compound sometimes used to treat seizures, migraines, pain, and other medical conditions.
We recently upped his CBD oil dose, and the next morning he tied his shoes for the first time in his life.
Bryce and Holly Bunderson testified on behalf of their son Scout. The family has been treating Scout's severe seizures with CBD oil illegally.
I will give him this medicine if I go to jail. I don't care. I'm going to save my son's life, and this is saving his life.
Testifying against the bill Friday, members of the law enforcement community and the Idaho Office of Drug Policy, who raised concerns about CBD oil being a gateway to marijuana use, lack of FDA oversight, and the possible strain it could put on local law enforcement agencies.
This whole process is politicized, and the FDA is not allowed to scientifically look at what is the difference between hemp and what is the difference between cannabis and marijuana.
But what I am also frustrated with is this: well, we got to go through an FDA process, and although I'm respectful of the process and I understand how important it is, it's also not perfect. We have an absolute opioid epidemic, not only in our state but in our nation, from a series of drugs that the FDA put out and approved that are highly addictive, that have created tremendous problems for us.
If the House passes the legislation, it then heads on to the Senate side for approval. Reporting inside the State House, Marissa Morrison, 6 on your side.
This bill would not affect Idaho's expanded access program, which is a clinical trial for a selected group of Idaho children with epilepsy.